Hello everyone, thank you for joining this session of questions and answers with Dr. Bolad. I'm here to help you with all the information that you need for you to be aware of your general condition, and also when you go to your doctor, you are familiar with what he or she really says to you. So I understand that you are tuning in from different parts of the world. Here in the United States, it's early hours of Sunday morning. In Europe, it's in the afternoon. Africa, it's in the afternoon. Middle East, it's the evening. Far East, it's nighttime. Last time in this questions and answers session, we had someone from Singapore who was tuning in, and it was almost midnight. So I understand that you are from different time zones. I hope that the weather is better than what it is here. I woke up here this morning and there was snow everywhere. I hope wherever you are having a bit of a warmer weather there. With that being said, I also have to say I received quite a few questions for this questions and answer session, and you can ask me directly during this session and I'll be more than happy to answer any questions that you have. Let me see if you have got anything now, any questions here that have been waiting here. You can just give me a second here. Okay, so what we will do now, we will start the session with the questions that I received, and I will show the question on the screen so that all the viewers are aware of it, and we can share really the reason why I'm answering. So if anyone is joining in at any time, he or she would be aware of what is going on here. So this is the first question I received from Cameron. When my heart is big, can it cause my eyes and legs to swell? Thank you very much for this question here. When your heart is enlarged, that means that very likely it has been affected by some sort of heart disease, or heart failure is the commonest manifestation of this. And when it's enlarged, that tells me that the function of the heart is not as strong as it should be. And as a result, the circulation is not moving the way it does, and therefore there is some degree of stagnation of fluid in the body. The blood is circulating slowly, but the hemodynamics are not optimized, and it's very common to have some manifestations of swelling. He said the eyes and the legs to swell. Yes, it is possible. Let me see if I have got a slide here that can help you understand about the stagnation of fluids here. So one very common symptom here you can see is that, and I'm just going to show it here, is that you can get stagnation of fluid first in the lungs, and that can cause fluid to accumulate in the lungs and get shortness of breath. This is known as pulmonary edema. Pulmonary edema. So this is one form of stagnation of fluid here. The other one is also the swelling in the legs, and you did mention, can you get swelling in the legs? Yes, you can. When the heart is large, that means not functioning well. Yes, you can get swelling in the legs, and also you can get the neck veins to be distended, and that's what we call jugular venous distension, or JVD for short for it. So yes, you do get swelling and stagnation in the legs. If it is that severe, yes, you can get it in the eyes, as you just mentioned. So this is possible. So the treatment is obviously, number one is to find out the cause why that is and try to reverse it. Number two, the immediate treatment would be to start on water medications to try to take some fluids off the body, and also other medications to optimize the heart to make sure that it is functioning optimally in a good shape. So yes, these things do happen in enlarged heart, and there are treatments for it depending on the cause. I got a question here, but it's in a different language. So if it said heart, I'm just going to show it to you here, but I really don't understand. So whoever has written this question, can he please just elaborate more in English? One thing I understand is heart beats, but then I don't understand what the question is. So please elaborate, and I'll be more than happy to help you. I'll go to the other questions that we got. This is a question from Romania. Hello, doctor. Reaching out to you regarding my case of pericardial effusion diagnosed last month. I am in my 30s, full blood test, CRP test, tuberculosis, thyroid, full CT scan, and they cannot seem to find the cause. I am taking colchicine just in case. And just for my viewers, here colchicine is an anti-inflammatory medication that we give sometimes for people who have got inflammation of the covering of the heart, and that's what this viewer is saying. He has got like fluid around the heart, which is pericardial effusion. Also, colchicine is a medication that some of you might have had if you had gout before. It's the same medication, but we also use it here for the heart. I will continue with the question. And I am monitoring the problem every couple of weeks, and there has been no change since the diagnosis as to the cause. There is a follow-up part to the question that I am going to share with you. It all started when I had a feeling similar to an anxiety attack, shortness of breath, whistle in my ears, and just feeling lightheaded. So I got an appointment to check up my heart, and there was no direct link as to the so-called anxiety attack and my heart condition. Thank you for your question. So this was an incidental finding, to find that there is some fluid around the heart. You are young and there is no obvious cause, and they have done all the blood tests that they could find. Number one, what I would like to know is that how much is this fluid? A very small rim of fluid can be found sometimes, and it can be completely normal. It can be found by CT scan, it can be found by an echocardiogram. So this is sometimes, if it's small, then, or it's minimal, then it's of no consequence, and this can be found normally in normal people. So the first question to you is that how much is this fluid? If it is moderate or large, that's a different story. For the sake of answering the question, say it is not the normal, it's abnormal, and we are trying to figure out. The most common cause for this is inflammation, some form of viral inflammation, and for which you give the colchicine in addition to some painkillers, non-steroidal anti-inflammatory drugs like ibuprofen, etc. So these are the first line treatment. If these do not help, then we go further step. If there are symptoms, we sometimes go to steroids. And there are other treatments, but in the majority of cases, these are more than enough to help. Let me try to see if I have got any slides here to share with you so that the viewers can understand about this condition that you mentioned. Okay, so this is what this subscriber from Romania has mentioned. So pericardial effusion, if you can see the heart, around the heart there is a sac, which is a normal sac. It's called pericardial sac. Usually there is minimal fluid around it, but if there is more fluid, as is shown here in this heart picture, then it is abnormal. So this is abnormal, and that is what is being referred to. And here I can show you that you can see the pericardium is the covering of the heart, and when you get inflammation, that's when you get accumulation of fluid around it. The viewer here did not mention that he had much symptoms. It was just like it was found like an incidental finding, and therefore if it is not causing symptoms, I would just observe it. You have already done the tests and you have already been put on medications. Follow up with your doctor regularly, maybe repeat tests which shows that it has come down, or at least it's stable, it's not enlarging or compressing the heart, because that's what we worry about, that the fluid around the heart accumulates to such an extent so that it compresses the heart, just like seen here on this picture on the right side of the screen. When it is squeezing the heart, then the heart will not be able to fill and empty as usual, and therefore this can lead to serious hemodynamic consequences with drop of blood pressure, and this obviously can affect the function of the heart and of the body as a whole. So I hope this answered your question. If there is any follow-up question, please feel free to ask. I've got another question here. Hello doctor, any health advice for a person with heart problem together with gastric continuously burping? Thank you very much for this question. So it depends really on the cause of the heart problem here. So if you have got indigestion, sometimes this can be a manifestation of heart disease, and we get lots of people refer to us sometimes with indigestion, and this can be the manifestations that they have got blockages in the coronary arteries. Usually blockages in the coronary arteries can manifest with chest pain, as the classical symptoms, center of the chest, neck, left arm, but sometimes you get like pain in the stomach as a manifestation. I don't know how old you are and what risk factors you have. If you can let me know, then that would be helpful, so I'll try to help you. So it also depends. This is chest pain is one that can present with similar abdominal symptoms. The other one is that if you have got fluid accumulation in the body, heart failure, just like what we were talking about for the first question here. So this can sometimes cause bloating and feeling unwell. And these are the main things about the stomach. Burping continuously is a different symptom. Usually it is not related to continuous burping. So your doctor will be able to help with that. But from a heart standpoint, I would like to figure out whether there's any blockages in the coronary arteries, and your doctor might be able to help you with that. And also, what is the heart function of the heart? In addition, we also need to figure out whether the heart is beating normally or whether there is irregularity in beating, meaning arrhythmia. So these are the things that need to be ruled out if you are to rule out this gastric issue. Burping is not generally related to that, but sometimes it's coincidental, and sometimes it can be a manifestation of a wider issue. And that's why we need to figure out all these three things first: coronary disease, heart failure, in addition to arrhythmia. This needs to be ruled out. If these are all fine, then your doctor will probably need to find other causes for this burping that you are having. So the one I got here is that you are 50 plus. Okay, so for 50 plus, yes, I would say that these tests will need to be done. because this is the age in which that you have to rule out other issues in the heart. So you're absolutely right. So that's what the things I just said here. These are the things that I would ask that you go and check with your doctor in order to make sure that they don't exist and therefore your heart is healthy. I hope this answered your question. If you have got any follow-up question, please feel free to ask. I got another question here from Sarah. Hi Sarah. Myocarditis that causes ventricular tachycardia in 2021. Ablation in 2022 was a success for 1 month. Then metoprolol stopped working and VTAC came back with 3 new trouble spots. Does this sound chronic? Sarah, for this myocarditis in 2021, so I wonder what was the cause of the myocarditis. Usually it resolves, but obviously in your case it did not, and then you had the ablations here. When you got foci of ventricular tachycardia, then it's not uncommon to find multiple sites. Sometimes still they can go back and do VT ablation, provided that your ventricular tachycardia speed, means the heart in which the ventricular tachycardia is not too fast, so that when they induce it, you are hemodynamically stable. Even sometimes when you are not that stable, they can put in some equipment to help the heart while they are doing the VT ablation. I don't know how old you are, Sarah, but if the younger you are, the better chances of it being gotten by ablation rather than by medications. The other option would be, obviously number 1 is medication. You have metoprolol, but you can be putting on other medications for ventricular tachycardia. Lots of antiarrhythmic medications are there. Sotalol, flecainide, amiodarone. There are lots of medications, and depending on your condition. Also, it depends on where this ventricular tachycardia is originating. Is it originating from the left side of the heart, or is it originating from the right side of the heart? The ones from the right side of the heart can be gotten much more easier than the ones from the left side of the heart. So it depends also on the site, on where it originates, and depends on whether there's any scarring and multiple foci, so many that they can't really figure out. But in most cases, it is treatable. And in most cases, you still can get relief from it. If they can't, sometimes what we do is that we put patients on medications, and then if there is this ventricular tachycardia is serious and the heart function is weak, then we put in a defibrillator. But this is not the first line unless you couldn't figure out and it's causing really a threat to your life, because ventricular tachycardia, when it happens, the heart is pumping so fast, the lower part of the heart, and therefore there is no time for the heart to fill in. For the sake of our viewers here, so they understand, let me see if I have got a slide here that would help the viewers understand about ventricular tachycardia. Let me see here. So I'm sharing this slide here for the viewers. So what Sarah is saying is that she has got ventricular tachycardia, meaning that the heart beats fast from the ventricles, which is the lower part of the heart. The arrow here is pointing to the right side of the heart, but it can also be coming from the left side of the heart. And the problem is that because it's coming from the lower part of the heart does not have time to fill in. And if it doesn't have time to fill in, therefore this leads to significant drop in blood pressure and hemodynamic consequences. So if it lasts for more than a few seconds, it can be serious, and that's why it needs to be treated. So this is just for our viewers here. Okay. So this is a follow-up to Sarah's question. So they suspect it was caused by a virus, and you are 43. Okay. So Sarah, you are young for sure, and if it does not resolve, if this viral infection does not resolve, then most of the time they should be able to go and figure out where it's coming from and treat it. Because you are young, this ablation and medication should be ablation board should be the first option, because today if you are in your 60s or 70s, then you really we can manage things usually with simpler stuff, but because you are active, fairly very active when you are young, then if your doctor thinks that ablation is possible, then that should be the first thing. And because it's viral, lots of the times, then this can be treated with ablations, and it can resolve spontaneously. So this has lasted obviously for some time. So therefore it's getting to the chronic phase. Yes, you mentioned that in your first part of your question. Therefore, medications in addition to the possibility of ablation would be the first choice if that can be achieved. I hope this answered your question. If you have got any other questions here, follow-up question, I'll be more than happy to answer. Okay. A question. Hello, doctor. 18 years old here. I notice sometimes my heart muscle hurts when I walk too much on cold air, but the ECG and heart muscle blood tests are fine. This pain happens every 2 to 3 months. Is it normal? And there is also a follow-up question. And the other question says there are no other symptoms. So with all that, you're young, 18, heart muscle hurts when you walk. So the fact that you are that young puts you at a less likelihood of you having coronary disease. So the issues when you get heart that hurts, either coronary disease, that's if it is from the heart, either coronary disease or inflammation of the muscle of the heart or inflammation from the covering of the heart. So the fact that they have done tests on you here and nothing really is abnormal, then that is reassuring in itself. And you said when you walk. So one thing they can do, because you brought this issue, is only when you walk on cold air. You might want to discuss with your doctor whether he or she would be open to putting you on a treadmill for an exercise stress test. Exercise stress test. So that would tell us what happens when you run. When you are on exercise stress test, they put you on the treadmill and you have got ECG electrodes attached to you, and we can monitor to see what's happening in the heart. This would be my suggestion, and that's what I would do if you came to me with these symptoms. I just would like to know what is happening. The fact that you are young points away from coronary disease, unless you have got a very strong history of coronary artery disease or heart disease in the family, then that might happen at such a young age. But with these symptoms, that's what I would do. When you exercise, you said you get the symptoms, therefore I would like to reproduce the action that produce your symptoms, and then see on the ECG, the stress test, whether there are any changes there. So this is what I would suggest that you discuss with your doctor if they are open to do this. Then that would be my thing for you. Okay, and you also followed up with your question and you said there is no family history of coronary artery disease. Okay, so this really puts it that I would do exactly like what I said here. I will put you on a treadmill, ask your doctor whether he or she are open to putting you on the treadmill just to simulate your actions, and then look at the heart at that time. These symptoms can be coming from somewhere else, but that's what I would do here. Another thing you would want to discuss with your doctors, whether she or he are open to do just an echocardiogram, and that is basically an ultrasound scan of the heart. Ultrasound scan of the heart, and that would be additional investigation just to cover everything. So that's what I would say to you. Thank you. Okay, another question here from Riyadh Hassan, 78 years old. I replaced 2 stents 2 years ago. It was okay. Now I notice pain on my chest when I start walking, and the pain disappears after 3 minutes. Well, thank you for this question. Obviously, Mr. Hassan, you have got coronary artery disease and you had stents. And just for my viewers, let me try to see if I can share a picture with them here. So this is the stent, and this is stent that we put in the coronary arteries of the heart for blockages in order to relieve the blockage in the coronary artery and to maintain the circulation to the muscle of the heart. And this is just for my viewers here, so to understand. So, Mr. Hassan, the fact that you have got stents and now everything was okay, and now you have got recurrence of your symptoms, then that points out that there is possibly a recurrence of the narrowing, and it's not uncommon. It can be either in the stent itself, or it can be in other part of the coronary artery or arteries. New blockage developed over the years. So the fact that this chest pain when you start to walk and disappears after 3 minutes and disappears after 3 minutes walking, I would still get this investigated. With your history, I would get this investigated. You might want to discuss with your doctor whether they would consider you for a stress test as well, just to cover things. You are at a high risk of blockages. You already had a stent, and therefore we take every symptom that you brings seriously. The fact that when you start walking, you get it, and then disappear 3 minutes after walking. It's unusual for the symptoms to disappear after 3 minutes of walking, but with the history you are giving, any symptom related to that, I would take it more seriously and more effectively. Today, if you did not have heart stents, then I might not really take it as serious, but with your history, I would not let this go uninvestigated. At least do a stress test. So discuss with your doctor this, and discuss with him or her whether they are open to having you have a stress test in the first instance. And if that's abnormal, then obviously you have to proceed for cardiac catheterization to evaluate what is happening with the stent. But that will need to be investigated. So please check with your doctor for that. Okay. I've got other diseases, other questions I got, and so I'm going to share them. They were sent directly to me. A question from Pakistan started by saying, male 62, no problems before heart attack. Heart attack on 23rd of July 2020. Felt heart congestion, 1 artery blocked, 2 arteries are tight. Doctor advised bypass surgery. I didn't. No palpitations, breathing problem which starts on walking. Hard work or after eating. Diabetes 3 months. Results 6.5 in 2020, 5.5 in 2021, and 4.8 in 2022. And this diabetes, this is for my viewers, this is a hemoglobin A1C that we measure the control of the diabetes with. Anything less than 5.8 or 5.5 is good. So the diabetes has been controlled well over the last 2 years. This is, I would say that the blockages that you had, basically you have got one artery which is blocked and two arteries are tied. This is what we call three vessel disease. And the question to you would be, are they in the proximal part of the arteries or in the distal part of the artery? So with your history of diabetes and blockage, you are more likely to benefit more with bypass surgery rather than with stenting. But it also depends on the location of your blockages. If they are in the proximal, meaning part of the arteries, meaning they contribute to significant reduction of flow to the other parts of the heart, then something will need to be done about it. And the fact you are diabetic, I tend, just by reading what you mentioned, to concur more with your doctor that bypass surgery might be the best. But it also depends, as I said, where are these blockages. If they are in small arteries, then it might not be an issue. But if they are in big arteries of supplying the muscle of the heart, then definitely bypass surgery would be one thing to consider. And yes, for my viewers, I'm going to share this slide. This is a bypass surgery in when you have got blockages, especially in patients with diabetes. They benefit more from bypass surgery rather than with stents. Then you take like an artery either from the chest wall, as you can be seen here in some examples, or from the legs, and then bypass the blockage, meaning you reroute the blood to the area which is affected to be supplied directly beyond the blockage, so that that part of the muscle gets the flow of blood better. So bypass surgery is generally better when you are diabetic, and that is something which has been proven, so there is no doubt about it. So three vessel disease, if they are in large arteries in a diabetic patient, yes, I tend to concur with your doctor that bypass surgery might be a better option for you. Unless obviously you say, no, I don't want to, I will take the risks. Then obviously the doctor will have to help you in whichever way and maybe consider stents. But the first option would be bypass, unless you refuse, in which case the doctor have to decide whether he or she can place in stents in these arteries in order to help you and help the flow of blood to the heart. So a question from Angola. Please sir, at times in the night feeling pains and heart making noises in my heart. What can I do about it? It makes me wake at night, please. So this is a question, pains and heart make noises. So I suspect that what you are complaining of are palpitations. And when you get the palpitations, sometimes you get some ache. And the palpitations are extra beats that come in the heart. And it can be to one of so many different reasons. And it can be giving you symptoms. And that's when it happens. If the heart is beating fast, then that can give you the chest pain. So this is, I suspect, what is occurring with you here. So the first thing would be to check with your doctor and try to see if you would benefit from a heart monitor in order to figure out what is the cause of these palpitations. Let me try to share with my viewers so they also understand about what we're talking about here. So let me see if I've got any slides that would help the viewers here regarding this. Let me see. Okay, so these are the cause of palpitations. I'm just going to go through them briefly here. So one of the common ones are the premature atrial contractions. This is just extra beats that originate from the upper part of the heart, and they can give rise to the abnormal sensation of the heart skipping a beat. The other one is just an extra beat from the lower part of the heart, and this is premature ventricular contraction. This is extra beat. Slow heart rate usually doesn't give you the palpitation. Ventricular tachycardia. Remember, there was a viewer here in the last 20 minutes. We spoke about ventricular tachycardia. These are like the ventricular echo, but it comes in runs, one after the other. It's not just like one single beat, and this can be quite significant. Atrial fibrillation is a very common type of arrhythmia, can cause all these extra beats in the heart, and atrial flutter would be another one that can give rise to symptoms. So these are all things that can give you rise to the abnormal sensation, extra beats, and chest pain. It's possible that this can happen. And the heart monitors that I was talking to you about, there are different types of heart monitors that you can put here. One of them is what we call the Holter, the 24-hour Holter. Basically, it looks like this, and it accumulates accumulates data from the heart for 24 to 48 hours, and that would give us information if your symptoms occur regularly and frequently. Therefore, this should be enough, just like 48 hours monitors. Other monitors is something like this. It's like a patch that you just stick on the heart, and it records you stick it on the chest wall, just over the heart, and it records the beats for as long as 14 days. In this case, this is a Z patch, we call it. And then after that goes for analysis, and it tells us what is happening. But there are also other variations of this that can record beats for up to 1 month if your symptoms don't occur that regularly. So this can be monitored for a longer period of time. And there is a type that you are outside and there is a monitoring center, and that will be directly every time you get abnormality. A monitoring center will be notified about it. It transmits through a mobile phone to the monitoring center, so you are monitored all the time. So there are different types of heart monitors that can be used here in order to figure out what is the cause of these extra beats that when they occur, chest pain occurs. So that's what I would suggest you discuss with your doctor, whether you would benefit from any of these monitors in order to figure out what is going on. And also, depending on your age, the doctor might decide to do other tests here. Okay. Here's a question from Ghana. Please, is irregular heartbeat reversible? Is irregular heartbeat reversible? Yes, in lots of times the irregular heartbeat can be reversible. It depends on the type of the irregularity. This can either be treated with medications most of the time. Sometimes it might be very simple and nothing need to be done. Sometimes medications. Sometimes the irregularity, which one of the very common irregularities that occur in people, is something that we call atrial fibrillation. And atrial fibrillation occurs in 10% of the population over 75 years of age. So for people over 75, 10% of them, if you take 10 people, one of them will have atrial fibrillation. And atrial fibrillation is an abnormality that tends to cause the heart to be irregular, just like what you are seeing here on the screen, completely irregular. And this irregularity tends to cause inefficient circulation in the heart and predispose people to have clots in the heart. So in addition to trying to regulate it, people will need to be on blood thinners. So the irregularity really depends on the cause of this irregularity. Let me follow up here. I think you sent another question. Okay, and you said here, what is the cause of the irregular? Okay, so as I just discussed, you might have been watching just in the past few minutes, I have gone through the causes of palpitation and irregularities. So either some extra beats like premature atrial contractions, I just mentioned them here, but I can go mention it quickly here for you again, just for benefit. I won't go into detail because I have just gone through them for another viewer. So the irregularities can be due to premature atrial contractions, beat coming from the upper part of the heart. It can be due to premature ventricular contractions, beats coming from the lower part of the heart. Ventricular tachycardia, beats coming from the lower part of the heart but lasting longer period. Atrial fibrillation, this is the EKG rhythm that I just have shown you. And atrial flutter, this is a circuit in the heart that develops. I suggest that also, I think that what you meant, what is the cause, what do they come? Due to different reasons. As we all age, the hemodynamics of our heart change, and also the tissues of the heart change in properties, and so does the conduction system in our heart. All these changes that come with time does predispose us to have an irregularity in the heart beating. So this is dependent on person to person. So if you are having this, your doctor will need to figure out what these beats are by going through the monitors, which I just discussed just before your question. So I think that you might have seen that. The types of monitors, either for 24, 48 hours, or for 14 days, or for a month, to figure out where it is. Number two, your doctor will need to investigate your heart to see what abnormality, if you have one, that predisposed you to have these extra beats, and to try to correct the underlying abnormality first. Correct the underlying abnormality first, and then try to figure out secondly how to correct the irregularity of the heartbeat. So you need some investigations for that. I hope this answered your question. Oh, okay. So you followed up with your question. Yes, it's for your mom, and your mom is 76. Absolutely. So that will need to be investigated. Your mom will need to have monitors, because as I said, in the 70s, one of the very common irregularity is atrial fibrillation, and it is this one here, and this can have serious consequences, irregularity in the heartbeat, and you need to be on blood thinners. And if we can, we need to put this rhythm back to the normal pattern. There are so many different ways to do that, either with medications or giving a slight electric shock or with ablation. But also you need to be on blood thinner if you have that sort of abnormality, which is common on people above 70 or 75 years of age. So that's what I would suggest. Check with your GP or your doctor, primary care physician, figure out the cause, and then we go from there. Every irregularity has got different treatment. So that's what I would say here in this case. Okay. So a question from Accra in Ghana. I am almost 45 years of age. I have been experiencing tiredness, weakness within my heart for a little task I do. Example, walking a short distance or carrying a bucket of water to the washroom. Tiredness and weakness with my heart for a little task I do. I mean, you are 45, you are at an age that commonly cardiac issues might manifest. So if this is something new and you have been experiencing this tiredness and weakness, I don't know what symptoms you are saying, but tiredness and weakness can be due to so many things. But if you feel exhausted and you're short of breath with these manifestations, then you will need to be investigated for possible underlying heart disease. So there are so many tests to be done. The first thing would be to put you like in a treadmill to try to see what's your exercise capacity like and how your heart behaves with you going on a treadmill. That would be my very first test to do if your symptoms really pointing to possibly heart disease. A simple test just like putting you on a treadmill and connecting electrodes to your chest wall and monitoring on the heart's monitor to see if there is any irregularity. Your symptoms can also be due to so many different things. Tiredness and weakness can be due to so many diseases, so many things. Your doctor might need to investigate it. One of them, yes, might be the heart. So for the heart, check with your doctor, might be able to prescribe you being on the treadmill, and that would figure out for us whether it is a primary cardiac issue or not. Okay, so going back to the question that we had, I have got a follow-up here from our viewer regarding the irregularity in the heartbeat. She has done all the investigations and they say she will be on Xarelto for life. Okay, so the fact that they said she's going to be on Xarelto for life, that means it's very likely it's atrial fibrillation. One thing importantly is to try to put the heart rhythm back to normal if they can, because that makes the heart function as normal as possible, if they can. Sometimes, as I said, with age it just occurs and they couldn't find out the reason. The fact that he's on Xarelto tells me that's very likely it is atrial fibrillation. There are different ways to treat it. Electric shock, to put the heart back to normal, medications to keep the heart beating regular, or it can be just medication not needing an electric shock to put heart back to normal. In people who are compromised, very much compromised, ablation can be done. Now, regarding the Xarelto, which is a blood thinner for life, and that's what you mentioned here, that means that there are some predisposing issues that make her likely that even if they have put the heart back to normal, she will need to be on blood thinners because her risk of clot formation is high. And if your risk is clot formation is high, then we worry that she develops a clot and this clot then migrates from the heart to other parts of the body, and then that can cause a stroke, or it can go to, if it goes to the brain, it can cause a stroke. If it goes to other parts of the body, it blocks the circulation, and that can have some serious consequences. So in order to reduce the risk of that happening, you put people on Xarelto, sometimes for life. I just have to point out one thing: in everything we do, we have to balance the risks and benefits. So there is the risk of clot formation, and there is also the risk of clotting. And so the risk of clotting and bleeding. So the risk of clotting in one hand and the risk of bleeding on the other side, because a blood thinner can make you bleed, especially the older you get, the more likely you are to bleed. So your doctor should be able to discuss with you the risks and benefits of preventing clot and of the risks of obviously inducing bleeding. So we have got scores, we have got that help us decide about these risks and whether we should start blood thinners or not. I take it that your doctor has started your mother on Xarelto. He or she has calculated that the risk of bleeding is not that high, but that's one thing you have to worry about, and you have to be careful, because if you are on the Xarelto, for example, you bang your skin or you bang your arm or leg or you hit your head, there is the risk of bleeding is high because you're already on blood thinners. So this is what we worry about, is the risk of bleeding when we start people on blood thinners, especially for life. So discuss with your doctor if that hasn't been discussed as yet, the risks and benefits of starting the Xarelto, the benefits of preventing clots versus the risk of bleeding. That's what we worry about most of the time. So this is something to discuss with your doctor. Okay. Got another question here. So this is a question from Nigeria. I sometimes have palpitations. I have done some test, echo, ECG, and I'm told everything is fine. I also have high cholesterol and high blood pressure. What can I do about this? So the echo might be normal. A normal ECG does not rule out palpitations, and the reason being, you are doing the ECG at a particular part in time. So if you are not experiencing the palpitations at that time, then the ECG might be normal. It does not rule out that you do not have palpitations, and it does not rule out the cause of the palpitations. The only thing that would be helpful to find out the cause of the palpitations is to do a heart monitor, and I have shown examples of heart monitors here in this session. So I'm just really for your benefit. The one type of heart monitor is something like this, which is basically a Holter monitor, and that would show the heartbeat over 24 to 48 hours. So this is one type of heart monitor. Another type of heart monitor is something like this, like a patch you put on the chest wall. This can record up to 14 days. This particular type I'm showing you here. And then you get sent for analysis, and then we can find out what your heartbeats have been for the last 14 days, and then we try to see if we can find out the question or the answer to our question regarding the palpitations. If that doesn't give us an answer, we can go for something which can be put in for a month at a time. And this is like recording continuously. And the example I'm showing you here on the screen transmits regularly to a monitoring center. And then if anything happens, or if there is anything serious during the monitoring, they will call straight and they will tell you about this irregularity that they are seeing there. So these are all things to be considered. A normal ECG does not exclude the cause of palpitations or whether or not you have palpitations. Heart monitors are the way to go here. So this is what I suggest that you discuss with your doctor. So a question from Ghana. What can be done after a valve replacement and still there is a dilated valve? So I'm not sure which valve was dilated, was replaced, and which valve is dilated. When you have replaced a valve, generally the valve doesn't, the area does not dilate further because the valve has been replaced. Usually it's metallic, or if it's not metallic, it's a tissue, but there is a metal ring around it, therefore it won't dilate. So I suspect that you are meaning a dilated valve, separate valve. So currently we have got so many different techniques that we can do to help with that. The first question would be, is it something you can treat medically with medications, or is it something that we need really to do either surgery or interventional techniques? There are so many different ways for different valves now to be treated, especially valves on the left side of the heart. Let me see if I can just show you an example of the valve for our viewers here, in order to be able just to understand and see what we are talking about here. So the valves generally that dilate most of the time are the mitral valve, is the commonest that dilates and cause a leak, which is mitral regurgitation. It's on the left side of the screen here in the red section of the heart. So this is the commonest one. The tricuspid valve on the right side might also dilate as a consequence of build-up pressure. This is the commonest causes I'm telling you about, but there are so many different causes for the valve to dilate. The problem is when the valves dilate, they start to leak. So when they leak, then that has got consequences. The valves in the heart has got one function, and that is to keep the blood moving in one direction and not going back. That's from one chamber, pumps it, goes to the other chamber, and when the other chamber contracts, it doesn't go back, it goes forward. So when you start to have a leaky valve, that means that the function is not good and the hemodynamics are not good, and they cannot serve their purpose for the flow going forward. So flow, part of it will go forward and part of it will go back. Therefore, the heart is not going to be efficient, and as a result, the heart dilates because there is an overload of the blood there. Therefore, it is not something that we have to let go. We have, if it is mild or moderate, we observe. If it is significant, we'll have to treat. There are so many different ways to treat it, either with medications or with interventional procedures or with redo surgery. So this all depends on which type of valve dilates or which valve was replaced, and whether we can do other things or whether it's we cannot control it with medications and we need to go to interventional procedures or to surgery regarding it. So this is what I would say here. I suspect the commonest valve to dilate, as I said, the mitral valve or the tricuspid valve, depends on its severity and the hemodynamic consequence before we can make a decision about what to do about a particular valve that is leaky and whether anything else needs to be done about it. So we are coming here towards the end of the hour here. For my viewers, thank you very much for tuning in for this session of Heart Clinic Questions and Answers. I am happy to answer your question anytime. I hold these sessions from time to time, so anyone who is worried about a particular question, they can send me the questions directly and I can answer them, and they can follow up with further questions. So thank you all for tuning in wherever you are in the world, and I wish that you have a good day, the rest of the day for today, and please feel free at any time to send me any questions, and I'll keep a look at my channel, YouTube channel. I always post the days in which I do have these live sessions. With that being said, thank you very much, and you have an excellent rest of the day. Thank you very much.